Welcome, welcome, welcome to day 6 of the HS Awareness Week Virtual Summit. Thank you so much for joining us on this beautiful Saturday. I hope it's sunshine outside for you all because outside my window in Cali, the sun is shining. So I really hope that you all are enjoying this weather. So before we get started into our conversation with the amazing Tia, who is an advocate, a HS advocate, and we actually met a while back, but we both did a campaign with AbbVie, which we'll be talking about shortly. And today is all about advocacy for HS patients. How do we do that? What does that look like? And what is there, what's the hopes for the future for the community and advocacy? So we're going to be discussing those different topics today. So thank you so much for tuning in. Before we get started, I would love to give a shout out to, of course, our amazing sponsors who have made this event happen. So thank you so much to the HS Foundation, the Mama IU, HydraWare, 100-page journals, designs by Muriel, HS Connect, Hope for HS, and Sugar Lovin'. Thank you so much for donating your time, your talent, and your resources to making this event happen. We are going to get started with the discussion today. First, I want to thank you so much for joining us, Tia. This conversation I feel like is important because we talk a lot about HS, the disease and the condition and how it affects us, but oftentimes I know that we see a lot of discussions in support groups and we're hoping for celebrities and things like that to bring more awareness to HS, which would be beautiful, but there are a lot of people who are already doing the work. You are one of them. So I wanted to talk to you about your HS story. Please let us know, where did you begin with everything?
Okay, so my journey with HS started in 2017. So I had, when I think back in my life, the signs were always there. It was all out, the HS was always there, but I wasn't officially diagnosed with HS until 2017. So I had I had the bulls and whatnot. I had been having those for, a couple of years. And I just really thought, I deal with obesity. So I figured, hey, I'm just, obese, or it's my diet or whatnot. So I just never um, really thought too much of it. But it had, by 2017, it was just like enough is enough. Um, I can't continue to live like this, because I believe when it really first started, it was in the earlier stages. And by 2017, it was just, it had advanced quite rapidly because I hadn't been getting any type of treatment. And I'm like, enough is enough. I'm getting ready to go out of town on a girls' trip, and I don't want to be in pain. I can't do this anymore. What is going on? So that's when I went into the doctor's office. I went into my primary care physician, and she said, I believe this is what you have. And I always like to mention that, and I guess I was just blessed with having a PCP who was an African American woman, because she knew right off the bat what was going on with me. So I'm very grateful for that. And I always like to mention that because, of course, as we all, if you are aware of this disease, or if you don't know, African American women, we get HS. Our incidence of HS is higher than any other racial group. So that's why I always like to say that that she is an African American woman, because she knew right off the bat what was going on with me. So, that's very important when I'm always, telling the story. So, from then on, I was able to meet with a dermatologist. At the time, the dermatologist that she referred me to was they were in the same office. So they were able to they were able to correspond back and forth with each other. Like before I got to the derm appointment, she was able to send stuff over. Like they were in the same, health system. So that helped. So, then when just hearing that I had a disease, and when I found out what was going on all these years, oh, okay, it's not just boils. And I actually had a disease. I still can't explain how that made me feel because I'm living with this. I've been living with this for years and I didn't even know what was going on. Like I consider myself pretty proactive with my health because I'm always doing my you know, yearly well checks and stuff like that. So I felt like I like how did I miss this? Like what what went wrong? Like why didn't I pick up on this? And so just knowing that I had something that was a long-term skin disease that I have been having, it just it was really hurtful that I had been dealing with that for so long and didn't even know what was going on. So um and now I've been able to process all of that. I'm able, initially when you find out that you have HS, I mean, you just feel like your world is ending. You don't know why this has happened to you. Why me? What's going to happen next for me? What am I going to do? Is my insurance going to pay for the treatments? All that kind of stuff. You just it's it's very mind-boggling
Mhm.
um, when you first get that diagnosis. But again, I had a doctor that knew what it was, and I had a dermatologist that was familiar with HS. And so, because of that, I was in good hands. But unfortunately, there's some people who don't have that good setup. They don't have a good PCP, they don't have a good dermatologist. So, I consider myself um, very blessed because of that.
Mhm, mhm.
Yes.
Absolutely. And what changed for you after you got diagnosed? Did the treatment get better for you? Did it get worse? What happened after that moment of diagnosis?
So we did the treatments for a while, and of course, there were different treatments that we were trying to get approved and whatnot. But with a lot of insurances, you have to go through a lot of red tape. But I had been doing, the topical treatments. I had been doing, the antibiotics, and I've been doing all of that. And I decided that I'm going to have to go the more invasive route, which is surgery. So I just, my HS, like I said, had progressed
Mhm,
because it had not been treated. And so at that point, it was no more managing it in the state that it was in. It was no more managing it with just topical creams and ointments and antibiotics. It was time to really do something major to try to reset everything, so to speak.
mhm,
So, that's what I went ahead and did. I really didn't want to do that,
mhm,
you know, but I said, hey, I've got to do something that is going to help me, as far as treatments and stuff like that. And I just felt like the antibiotics and all that, what we were going through was not going to, it just wasn't going to manage it.
mhm.
So, yeah. So, in 2018, I had my first surgery in October. And so I had the thigh area done. So, really long scars. That was a very painful surgery.
Mhm.
Um, and the recovery was a little bit difficult, but
Was
that
that
is when,
CO2? Or what procedure was that? Was that done with a scalpel or a laser?
well, I actually had, the, I can't, the name just slipped me, but we actually, the doctor actually went in and removed the skin. So he
Okay.
removed this, yeah. So
I think that might be CO2. Do you know if they used did they have like a pin looking thing? Do you know? Were you like awake for it?
no, I was not awake.
Oh,
I actually went under, and I wasn't able to do the twilight. I actually had to go under. So the name of the surgery, I don't know why it slips my mind, but anyway, the surgeon actually removed the skin. And so he removed the whole area, the whole affected area. And
mhm.
then he unplugged the sweat glands. And then with staples, I had medical staples, he actually put the skin back together. So I know it sounds really crazy, like medical staples, because I felt like a mummy
Mm,
after the surgery, but that's what he did. So that was the first surgery
mhm.
that I had. That was in 2018, and I have long scars to prove it. But that's when I decided, you know what? I think I need to advocate for this disease. I need to tell people about what's going on. So that was the turning point for me. And that's what got me into advocating for HS. Yeah.
Mhm. Absolutely. And I know that sometimes when we think about the surgeries that we go through, that part can be extremely hard, especially adjusting. And were you on your own for that in the recovery process, or did you have like a caregiver or someone to assist you through that?
My daughter, she was around. So she did help me and everything. But like you said, it is a process because it's people don't understand sometimes it's not just a physical something, not just physical is happening to you, it's a mental thing.
Mhm.
Especially for me, whenever I have any type of surgeries, it's you go into for me personally, I kind of like go into a depression afterwards. It's just like there's so much that happens after you have a surgery. But for me, that was the turning point because once I had the surgery done, I was just like, okay, you can mope around
Mhm.
about these medical staples that you have in your thighs and all this kind of stuff. You can just, if you want to mope around, fine. But you really need to do something productive. And that's
Mhm.
when I said, hey, I'll get out there and let other people know about this disease. Because I'm quite sure at that time I didn't know much about it
Mhm.
still, but I figured I'm going to turn a negative into something positive. So
Mhm.
that's what I decided to do.
Absolutely. What was
Yeah.
the first piece of advocacy work that you did? What did that look like for you?
Well, what happened, like I said, I was recovering from the surgery and I went on Twitter and I think that was around, no, either late October, a few weeks after, or the 1st of November. And I got on Twitter and I think I started off with telling a little bit about my story, um, and who I was, and I started following individuals, different organizations and different agencies and stuff like that that supported individuals with HS. And I started reaching out to some individuals as well
Mhm.
through email,
Mhm.
and that's how it got started. In the letters, I would let people know who I was and what I was trying to do, what my intentions were, and that's what I also did on Twitter. Um, just just something just really brief, and that's just how it just really just spiraled. You know, People started following me, people started taking an interest. It just really it was like a wildfire. If it started really small,
Mhm.
and then before I knew it, it became bigger than I thought it was gonna be.
Mhm.
So yeah,
And
yeah.
so HS patients, we deal with a lot of shame and guilt and grief. Um, and sometimes that can prevent us from doing things like advocacy because it puts us at the forefront most of the times, and we have to start speaking up about our experiences. For
Mhm.
you, how did you push past or change your relationship to the shame that you were possibly experiencing, or the embarrassment of having this skin condition, to move into a space of advocacy?
Um, that's heavy right there because we our community does deal with a lot of stigma. I mean, it's really bad. Um, and sometimes I have seen individuals, on social media, and they'll say, some really bad, really not so nice comments to people. And fortunately, I have not had anyone to say anything off kilter. But it is really hard when you are on social media to millions of people telling them that you have this disease, especially, in private areas on your body. Um, in in this day and age with social media, people are very vocal. They say whatever they want to say. And again, not always nice things. And so, what I just felt like I have a story to tell. Um, I didn't cause this disease. I didn't bring it on myself. Um, it's just, I didn't have anything. It's not like I brought this on or anything like that. So I felt like, if someone said something, whatever, and it's really hard because a lot of our people in our community, they're really struggling with the shame. It is very um
Mhm.
it's very deep, and a lot of people are like, I can't, thank you for speaking out and thank you for being a voice. And I'm like, hey, you need to advocate for yourself and you need to speak up and you need to, and they're like, I'm not brave like that. And they just don't have that strength to be vocal, and that's where we come in because, hey, what they can't do, we take all of that. And I always take all those experiences that I hear from different people, and that's what I bring into my advocacy. There's people who are really hurting, um, but that shame, that's it's really deep in our community, and that's something that we really need to address because
Mhm.
um, that that right there is one of the reasons why um, individuals are not getting diagnosed
Mhm.
like they should, as early as they should.
Right.
So that's something that we definitely need to talk about
Mhm.
at some other time, but we definitely need to talk about it.
Yeah, absolutely. Because I was reading a study actually, for an article that I'm writing, and the study was suggesting that a lot of people who experience medical shame, the shame it has an impact on health.
Mm.
There was a study that was done with some graduate students, and they put them in sort of like stressful situations, and they saw that there was a lot of cortisol that was produced. They're not exactly sure the long-term effects of something like shame has on health, but it does prevent people from not going to the doctors, the hospital, because you're just like, oh, it's something I did, so it's something I need to fix. And it's like, okay, this isn't something that you did. And you know also the fact that not a lot of physicians know about HS and are
Mhm.
not educated on the treatment aspect of HS, it makes it even increasingly more difficult to
Mhm.
feel like the medical system is actually reliable to actually help you. So the apprehension and the shame is very it's understandable from every single level. you know for you as an advocate, um what has advocacy done with, I guess, the shame that you might have felt? Like, has it helped to get rid of some of that, or are you still experiencing the shame from having this condition?
Not anymore. In the beginning, you do feel a little bit of shame because, um, you people will ask you, oh, what is that disease? And, they'll ask you um, different questions about the disease. And like I said, because it is in personal areas on your body, you are initially a little apprehensive and a little shameful
Mhm.
to discuss that with people.
Mhm.
But as time went on, and as I saw when I saw the effect that my advocacy was having on people
Mhm.
and how people really, really um, needed to hear about this disease and whatnot, that's when it started to subside because I'm like, okay, you know, hey, there's no shame in HS. There's no shame in having this disease. Um, and so that's for me personally, that's what helped being out there talking with different people from all over the world, all over the earth, and seeing that they need someone to be a voice for them
Mhm.
and they can't do that.
Mhm.
That is what makes me
Mhm.
that's what made me push forward. I'm like, hey, I don't care if I get some blowback. I don't care what comes my way. It is what it is with this disease,
Mhm.
and people need to know. So that's how I was able to cope. I was able to cope with that.
Absolutely.
Hmm.
What is your goal as an advocate overall? So, when you approach this, obviously it was to bring awareness to HS, but moving forward, as you are in this, what do you want to do ultimately?
Um, like I said before, the issue with stigma, that's something that really needs to be addressed.
Mhm.
And also going forward, I would like to one of my um, intentions is to really make sure that women in the African American community that they know about this disease because I'm telling you, there are so many of us who have the disease and we do not know.
Yeah.
And so, in the beginning, advocacy, I would have to say, really was for me in the beginning because it was a way for me to cope and manage with having the disease. But in the last year and a half, now it's been more about um, targeting, the African American race, our people, because again, the incidence rate is higher in our ethnic group. So that's really what I've been pushing for. I have made it clear. I'm talking to different individuals. This is the path that I want to take, and also, like I said, dealing with the shame. We definitely have to get rid of that. Because it's hurting so many people. So that for me right now, those are my two goals um, that I'm really trying to work on. As far as my advocacy, that those are my two goals.
Mhm.
Yeah.
Mhm.
Hmm.
Absolutely. And I want to talk about, with that being said, I really want to talk about the campaign that you just recently did with
Yeah.
that was awesome. What was that experience like? And can you kind of talk about what that meant to you as an advocate?
They have really been really good to me. They actually found me. So I'll just start with that. They actually found me. Um, they found me on Twitter and they reached out to me. They liked what I did. And I was like, AbbVie, this is a billion-dollar pharmaceutical company. You're interested in little old me. But hey, they liked what I did. And so we've been working together ever since then. And that ad that we just did, it was just wonderful. All the brown faces. And again, like I said, that's one of my goals. And it was just beautiful to see all those brown faces in the ad and the um, the response that we're getting. I don't know about you, but I'm telling you, my timeline has been blowing up.
Yeah.
People were like, this one young lady earlier. I think earlier this week, she was like, you know, I'm about to cry. And I was just like, what? She's like, because I've never seen HS, be in the public eye like this, like on this type of platform and being broadcast. And she felt like she was being seen and everything. And I'm just like, this is just wonderful. And I feel like within the last year, um, the awareness for HS is getting bigger and bigger and bigger compared to when I first started in 2018.
Mhm.
These past years, it has just a wildfire. And so I was just so honored to be in that ad. I'm honored to work with AbbVie. Um, we have a beautiful relationship, but I was so proud of of the finishing results. And the response is just it's beautiful. It's wonderful.
Yeah. Yeah, the patient, I feel like the advocacy part is, I mean, I think that any work that you do just as an individual doesn't need
Mhm.
necessarily validation. However, it is affirming um,
Mhm.
to get messages from patients. And especially,
Mhm.
when I started receiving messages from women of color, it was, there was just a fire inside of me that lit up
Mhm.
because I know that our community is very affected by HS. However, there's not a lot of information regarding how it affects us. Um, and so seeing that is sort of like, I don't know, it just brings joy. Like, is that
Mhm.
how is that what you experienced?
Yeah, it's just I had did an article with Women's Health that was published back in February, which coincidentally was Black History Month.
Mhm.
And so I have gotten so many people, just random people,
Mhm.
um, emailing me, telling me, "Oh, I'm so happy that you're an advocate. I'm so grateful for you." And I'm just like, it's just like you said, you try not to use external circumstances to give you that validation, like that's something that really has to come within. But when you get someone saying, I am so glad that you're speaking up and I have that and I've been suffering, and someone that is one of the greatest feelings in the world. You just the smile and the contentment and the satisfaction is like, oh, I'm really doing something. This is really helping people. You really feel good.
Yeah. Yeah. And I feel like at the same time, I don't know if you feel this way, you can let me know. But I feel like at the same time, I'm also sad because I'm like, oh, so many other people have this. Like, and I just want, I remember when I was young, it was classified as a rare disease.
Mm-hmm.
And they changed it because they were like, it's not rare. Actually,
Mm-mm.
just not sure about the
Right.
measurement. It is millions of people
Right.
for sure, at the least. So that's not rare,
Mm-hmm.
by definition. And so it is disheartening at the same time as joyous because the joy comes in. It's like, I'm so glad that you found this.
Mm-hmm.
Now come get these resources.
Yeah.
But
Yeah.
I'm just like, oh, I don't want to have to give the resources because I just don't want anybody else to experience this condition. Do you feel that way?
Mhm. Yeah, like you said, it's like a catch 22. It's like, wow, we're doing something great, and then you just you still feel hurt because you and I we've gone through it. We're living it,
Yeah.
and we know what the experience is like. And so, you know, one and we're happy, that there's more resources out here, and there's becoming a bigger awareness. But at the same time, it's just like, mm, it's still hurtful because we know what it's about. We're living it, and it's hurtful. And another reason why, it's just like this disease has been around for like what 200 years. It's been around,
Yeah.
and that to me, every time I think about it, I'm like, how is a disease around for 200 years? And we're just 2021, and it's just now um, that we're really, really, really getting where we need to get with it.
Mhm.
And so it's just like,
Yeah, that was one of the confusing things for me too.
yeah.
Uh, Especially, I read this article in the British Journal that was
Hmm.
speaking about Karl Marx, and
Hmm.
Karl Marx might have had HS.
Yeah.
And I was like,
Hmm.
well, this has been around since Karl Marx has been alive. Like,
Yeah.
and there's still no more info. Like, this is like, it doesn't make sense to me. You know, it's just like, so what were we doing? Like, this whole time, like, just
Yeah.
this whole issue. And it's like, it makes me wonder what the conversation was with like patients who would go to doctors and they would present, like, or did they go to doctors and present? Did they experience such a burden of shame that nobody really talked about it or diagnosed it, or, you know what I mean? So it's surprising to me too. It's really weird.
Yeah. Yeah. It's just, and like you said, what was the conversation like? You know, because we know that some doctors, and I mean, you know, they still don't know what it is. So I'm just thinking, like, way back then, you know, I can't imagine being an HS patient 100 something years ago. I
Mm-mm.
don't know what that would have been like. I
Yeah.
really don't. Because I know I've heard how hard it is for people now. And I'm thinking, like,
Mhm.
are we in the 21st century?
Right.
Like, really? Like, what's going on here? So, and so, like I said, that is the hurtful part, that it's been around for so long
Yeah.
and people are still suffering. You're just thinking, like, y'all have had enough time to get this together. But yeah.
Mhm. And it's, even though it's disheartening, it's like, at the same time though, the work that we're doing is going to help to push this treatment and awareness forward, so that
Mhm.
that stuff doesn't happen anymore, so that 100 years in the future, for our generations that come after, we're not having the same conversation. We're having more of a conversation of, what is the cure, what is the man,
Mhm.
what do we need to do to get this under control,
Mhm.
type of conversation. So this work is extremely important, and I know that it's, some people are called to do this type of stuff, and there are other individuals who are meant to just work on it personally on their own.
Mhm.
So that spark is, I don't know. I don't know. I'm just very hopeful, I guess, for the future, especially for advocacy and treatment and just the advancements within the HS community, honestly.
Yeah, I think we're on the right track. Like I said, when I first started advocating, and it hasn't even been 3 years ago, you saw it out there, you saw the awareness, you saw the ads and whatnot. But I'm telling you, like, within the past year, I'm really seeing more and more of it. And it makes me happy. When I go on Yahoo, I've seen stories of individuals that have HS.
Mhm.
you know I've seen it, on different websites and different, medical journals, and it just makes me happy that now we're talking about this, you know um because it's sad that it's been just, no one has talked about it. It's just like, just covering over something, and but you can't hide this. You can't not talk about this because it's serious, you know
Mhm.
But I really get a lot of joy when I see, um, different articles, you know, that have, HS,
Mhm.
or mentioning individuals with HS.
Yeah, absolutely.
Yeah.
And I wanted to remind everyone too, really quickly, that the Q&A chat feature, if you have any questions that you want to ask, please enter that in there, or you can send, if you can't find that, then you can just send the question directly to me, just using panelists. And we have a question from someone. An anonymous attendee said, how do I get over this feeling that I'm posting awareness on something no one's asking me for? I try to keep in mind it's about spreading a message to someone that may not know they need to hear it, but I struggle with not coming off as asking for questions about my own HS. Although I guess in a way, asking for awareness is asking for attention to the disease in general.
So the individual is like posting about their condition on social media, or are they?
That's what it seems like. I think they're posting and they're just saying they have a feeling of maybe that they're posting about HS and nobody wants to know about it type of thing. In the sense of like, I get what they're saying. I'm trying to articulate it.
See, you never know I've learned that just because people are not saying anything back doesn't mean they aren't digesting, the information. So, you know, s- sometimes you'll put something out there on social media and you won't get a response. People
Mhm,
won't say anything. You'll post something, you're like, no one said anything back. But, you don't know who's seeing it.
mhm,
Just because they're not responding doesn't mean they may still really appreciate you putting that information out there. They just, maybe they might be ashamed or afraid to respond. Maybe they don't want someone to know that they have HS. So when you put it out there, you know, put it out there and don't worry if people don't, want to hear about it. Don't think that you're getting on people's nerves, or put
mhm.
it out there because you just never know. Sometimes people will see stuff and they won't comment, but they are paying attention to you.
Yeah, absolutely. And what's interesting is too, like, I so the reason why I was saying I get what they're saying, because it's just
Hmm.
hard to say, is because I felt that feeling when I created my documentary for HS. I was like, who would
Okay.
care about me making a documentary on hidradenitis suppurativa? Like, you know what I mean? So
Yeah.
I was like, what? I shouldn't do this, type of thing. It's like I'm putting myself out there to potentially maybe get someone to build a community with me. Like, that's too much uncertainty. Like, it's like I'm gonna have to put myself out there and potentially possibly get embarrassed for me to figure out whether this is gonna work or not. And that is a risk, but it's something that's like, I feel like me personally, it's something that's almost made up in our minds because
Hmm.
I mean, this is gonna sound harsher than it is, but people don't really care about what other people go through, not that much. So it's just like when you post things, your community
Hmm.
will come around you. So the people who are meant to see the work that you're supposed to do are going to find you.
Hmm.
So
Hmm.
at first, I don't know if it was like this for you, but at least on my social media, when I first started out, there weren't a lot of people who responded all the time because
Hmm.
it was mostly my friends and family, and they don't have HS.
Right.
It wasn't until like a year later where I started gaining more momentum
Hmm.
in advocacy that I actually had friends come to me and be like, yeah, I think I have this too. And I'm just like,
Yeah.
we've been friends all these years. Like,
Yeah.
what do you mean?
Hmm.
Like, you just, but I'm grateful. I'm so grateful for, them reaching out. But I think that that's
Hmm.
say is like that overwhelming feeling of like, no one cares. So like, why should I do this? Type of thing.
Yeah. But that's the thing, you don't know. Like I said, you don't know who cares because like I said, sometimes people won't respond. They won't say anything back, but every day they're waiting for you to say something. They're looking forward to it. So
Yeah.
you just
And
never know.
one of the things that I'm so passionate about, like I think we are both passionate about the same mission, which is like bringing awareness to HS and just covering the African American community too. But one of the other missions that I am very passionate about as well, and I'm working as hard as I can, is normalizing it in media and entertainment. When we put it
Mhm.
in that space, then we start more conversation because people
Mhm.
consume a lot of entertainment and media. So it's not just on social media, it's getting things on, like, for an example, inserting characters on HBO Max shows who have hidradenitis
Mhm.
suppurativa. It's creating documentaries on HS. It's, going on Good Morning America and talking about it.
Mhm.
It's it's pushing HS on a platform like psoriasis, diabetes,
Mhm.
breast cancer, where it's known in normalized conversation, you know, because when
Mhm.
breast cancer first came about, women were ashamed of what they were experiencing.
Right.
So now we're in a space where everyone is raising awareness, money
Mhm.
for breast cancer. Companies, you know, corporations, everyone is behind it. And for me, my goal is to take HS from here to that space because I feel like in the future that's going to help to drive more treatment for patients and then to lessen
Mhm.
close that gap of diagnosis because there's no reason that somebody should be living with HS for at least 70 years before they get it.
Yeah. Ridiculous. It's just, and in some cases up to 20 years.
Yeah.
And as it's just like that's just unacceptable.
Yeah.
You know,
Mhm.
the mental anguish and the physical pain that they've gone through, um, that's it's rough. So
Yeah.
like you said, normalizing. And I was just they've been talking about how, the AIDS pandemic, how all that um unfolded 40 years ago. And I was reading something about it and I was like, hey, that's just where we're at right now because they had to know, that community, they had to normalize that.
Yeah.
Like the shame with that. I mean, I remember like people didn't even want to sit next to people with HIV AIDS. And I'm thinking like,
I remember
it was
remember that movie Philadelphia with Denzel Washington?
yes,
That's the movie that always comes to
yes.
my brain when I think about the AIDS epidemic at that time.
Hmm.
When I saw that movie, I was just like, wow. Like people really thought sitting next to someone would get you AIDS. I was like, for a sexually transmitted disease,
Yeah.
you know,
Yeah.
ignorance sometimes is really
Yeah. And I just feel like that's where we're at because now, it's just a chronic illness now.
Mhm.
With all the new treatments that they have and everything, it's not that death sentence that they had,
Right.
20, 30, 40 years ago. But that's where I feel like we are with HS. You need to normalize it,
Mhm.
not have all that shame and all that stigma. When people know that they can freely talk about what they're going through with their body,
Mhm.
that's the starting place. That's where we need to get to.
Yeah. Yeah. Because I mean, there's a freedom on the other side of that, you know, and I don't know, having the conversation also, I feel like it brings up things that you didn't know that were unprocessed about your experience, you know? Because I
Hmm.
didn't realize at a point, like when I was young, I didn't realize HS affected me at every aspect and every turn of my life. I was just like, oh, I have this condition and, you know, it might affect me when I have a flare, but I'm just like, no, this is affecting me when I take a shower because I'm in pain and I have to look at this and it's affecting my self-esteem, my social relationships and all this other stuff. And it can be very overwhelming to
Hmm.
have that realization, you know? But that's what talking about your experience and not even having it to be on a public platform because I think that when we think about advocacy and awareness, we're thinking about putting ourselves out there. And I feel like there are some ways that we can become advocates and bring awareness to HS without it if you're not comfortable right now being in the public
Hmm.
doing it behind the scenes. Like do you think have you thought of like any ways for patients to be able to do that if they're uncomfortable with being up, you know, in the forefront?
Well, you can create an online forum, you know, and so with that, you don't have to be out there like us, you don't have to have your face spread everywhere if you don't want to. Um, you can do an online forum, or you could be very active and very busy, on these different forums that are available, like, the different organizations.
Yeah.
You can be very busy with that, perhaps volunteer. Of course, a lot of things have changed with the pandemic, but I know there were walks, like there were HS walks, and there were different organized events,
Yeah.
so those kind of things, if you don't necessarily want to be, out there, you
Mhm.
can volunteer. There are ways to help behind the scene, even if you just want to have just like a chat on maybe a group chat like on Facebook or something like that,
Yeah.
on Facebook Messenger. You can do something like that. There's ways to advocate online support groups,
Mhm.
and you can be anonymous with that if you choose to.
Yeah. Yeah.
So you can do a lot
Yep.
behind the scenes. And so for people who who are still apprehensive, and don't want all of that, to be, front and center. Just do what you have to do behind the scenes, because it's going to help you. When you help other people with this disease,
Mhm.
it they always say, when you help others, that's when you help yourself and you feel really good about it. And for me, when I help other people, it makes me, I don't think about I have HS.
Mhm.
You know, I don't think about it. When I first got diagnosed, you think about it 24/7.
Yeah.
You know, you just it just goes on. You just keep thinking about it. But when you start helping people, you don't you don't have those feelings like you're thinking about it 24/7. You know who you are, you know what you have, you know what you're doing,
Mhm.
and you just keep going.
Yeah, yeah, absolutely. And another thing that I can think of too is radio podcasting, because when I
Mhm.
was young, I was in radio, and one of the reasons I got into radio is because it wasn't, my face anywhere. Like, it was just
Mhm.
and even though I was insecure
Mhm.
with my voice back then too, I was less insecure about that compared to, like, the presentation of my body. So I would encourage
Mhm.
patients too, if you think that you would like to have discussions around HS or things like that, you can use podcasting anonymously. You don't even have to put your face up. You can have, your name. You could do it under an alias. People do that all
Yeah.
the
Mhm. Oh yeah.
I have aliases for my writing, so it works like that, especially if you feel like, what you're talking about, you don't necessarily want to, I don't know. Just don't want to put your face to it, I guess.
Yeah. Yeah. Yeah.
So I wanted to wrap up by asking you,
Mhm.
what do you hope for the HS community moving forward? I love to end our conversations on a positive note
Yeah.
and just thinking about the future and what we all have to look forward to, especially advocacy and awareness for HS.
Well, definitely what we spoke about earlier, closing the gap.
Yeah.
I want to see that get closed earlier, um, because the longer that it continues, it progresses and it gets worse. So I want to see that gap close. I'm really looking forward to that. I know there's medications out there right now that are helping a lot of individuals, but I'm hoping that we can get to something um, that will get closer to a that will help us get closer to a cure.
Mhm.
Um, 'Cause right now we don't have it, but we do have the medications um, that are helping people manage and cope. But I'm hoping that we get closer to something else.
Yeah.
Um, and again, I'm hoping that we will be able to reach more African American women. I really hope that we're able to do that. So that's what I'm looking forward to seeing in the next couple of years. And I think we're on our way. I
Mhm.
definitely believe that we're on our way with it.
Absolutely. Absolutely.
Hmm.
I definitely feel the same way. And I don't know, HS, I definitely feel like there has been a lot more coverage, which is great. I've even seen stuff in Condé Nast brands like Allure magazine, which is a beauty magazine.
Hmm.
And imagine how powerful it would be for Allure to put at the forefront, not only in articles, because they create digital media as well, like videos, but to
Yes.
actually show, like, women who are dealing with it, what they're doing as their regimens and things like that.
Hmm.
Start the conversation, because I'm sure there are so many other women who are dealing with this
Yes.
and they just don't know what it is, and neither do their doctors. And so they're waiting to see that article and they're just like, oh my gosh, I think I have that. So I have so much hope, and I feel like I'm in the same space as you for sure.
Yes.
That's the,
definitely.
yeah. So I want to thank you so much. Thank you so much for having this
Thank
conversation
you.
and sharing your story and creating this space and for all of the work that you're doing, because I know it's not easy and it takes a lot of
Mm-mm.
emotional energy, a lot of physical energy,
Mm.
especially when you're dealing with a chronic condition like HS where inflammation is always present in the body. So I want to thank you so much for giving your time and your talents today. I really appreciate
Thank you. I appreciate it.
it.
Thank you so much.
Tomorrow, we are wrapping up HS Awareness Week and we are ending it with some Reiki healing. We are learning about how to manage stress and with HS. And so Reiki is essentially just energy work. So it's sort of like an energy healing. And especially after going through this week and having so much heavy information, I think it's important to rebalance ourselves. And Camille, who is the Reiki healer that will be leading the session, is actually going to tell you so much more about the practice and how energy work helps with stress management. So I think that you're really not going to want to miss this because it's a once of a lifetime experience, honestly. And I don't know, I do Reiki personally in my life, and I've done it frequently, and it's benefited me. Tune in, and I will see you all tomorrow. Thank you so much for joining. I hope you have a great rest of your day. Bye.